Good evening, everyone, and welcome to the Omega Psi Phi Fraternity's 2nd District Health and Wellness Committee monthly webinar. I'm Dr. Keith Boykin. I will be your host for this evening. I am a retired pediatrician with training in internal medicine. Our usual moderator, Dr. Kelvin, Brother Kelvin Ampofo, can be with us tonight, so I'll sit in for him tonight. I want to thank our current district representative, Brother Delrico Gales, for allowing us to continue to have this effort tonight. We focus primarily on prevention and also provide education and information about various topics as it affects our communities, particularly those of color. I want to start by saying that the opinions that are expressed here tonight are those of the individual guests and or brothers and do not represent the opinion or position of the Omega Psi Phi Fraternity Incorporated. This month is a special month. We have Mental Health Awareness Month and National Stroke Prevention Month. But we're going to focus on tonight just mental health. And in the future, we're going to talk about stroke prevention. So we have a special presentation for you tonight. I hope everyone will sit back and enjoy this because it's going to be some lively discussion again tonight. So with that, I'm going to turn it over to Dr. Jedan Phillips, our committee chairman, with his opening remarks.
Dr. Boykin, how you doing, my brother?
I'm doing just fine. How you doing?
78, I'm going to apologize first because I just finished with my last patient. But, you know, the interesting thing in what you just mentioned is after my day of patients today, a majority of them at one moment or another were mentioning mental health issues that needed to be addressed. And unfortunately, this is a condition or situation that is rampant, not only in our community, but in all communities. But unfortunately, there are some other factors that I feel contribute to it. So I'm looking forward to our conversation tonight. And again, I encourage all of you to continue to participate and watch our monthly webinars, which come on the last Wednesday of the month at 8:15, that deal with a multitude of preventive issues. So as Dr. Boykin alluded to earlier, this month is also Stroke Prevention Month. We will be having a presentation dealing with stroke in our next session in June. So looking forward to that. So I'm excited for our conversation this evening. I think we've got some great people involved, and I'm looking forward to the dialogue. Thank you.
Thank you so much, Dr. Phillips. I'm going to ask each brother that we have on before we present our special guest tonight. I'm going to ask each brother to give a brief 15-second introduction of yourself and your specialty, and then we'll come back to you and discuss how you will incorporate our topic for tonight in your area of specialties. So we'll go ahead and start out with Dr. Wingfield.
Everyone, and welcome to this month's Health and Wellness webinar. This has been a highly successful webinar and a series. And even if you look back at the prior months, I mean, the topics that we hit on are just outstanding in terms of reaching our community, educating our community. I'm Dr. Edward Wingfield. I am an interventional cardiologist. I treat all aspects of heart disease, primarily interventional cardiology, which involves stenting, angioplasty, patients with heart attacks. So the entire scope of heart disease I do cover. I'm the chief of staff at Robert Wood Johnson University Hospital at Hamilton, and looking forward to a lively discussion tonight. Mental health is first and foremost. When we talk about heart disease, mental health is one of the things that we address on a daily basis. As Dr. Phillips mentioned, on a daily basis, we're dealing with mental health. So looking forward to the dialogue. Thank you.
Dr. Isabell, give us your brief opening remarks.
Good evening. Once again, my name is Dr. Lee Isabell, board certified internal medicine. I do primary care, mostly outpatient, but I also do inpatient care, HIV primary care specialist. And I give you an aspect of mental health, outpatient as well as inpatient.
Thank you, Dr. Dr. Plummer, you go ahead and give us your opening remarks.
Good evening, everybody. My name is Dr. Christopher Plummer. I'm a specialist in obstetrics and gynecology.
Oh, we lost Dr. Ford. Go ahead and.
Oh,
back. I'm sorry. Go ahead.
My specialty is in obstetrics and gynecology and subspecialty in maternal fetal medicine in high-risk pregnancies. I am glad to have this discussion about mental health because pregnant women also do suffer significantly from mental health, and I'm glad to having a discussion with the brothers today. Take care.
Okay, thank you. Dr. Ford, give us your opening remarks, please.
Good evening. My name is Dr. Kelvin Ford, and I'm a board-certified internal medicine physician practicing in Prince George's County, Maryland. And it's definitely a topic that I broach every day with my patients. So looking forward to the dialogue and the discussion. Thank you.
Thank you so much. So you've heard the brothers give their different specialties, their different spaces that they work in, and of course the subject tonight is mental health. But we got a special little twist, a little spin we're going to put on tonight. So we've invited a brother of ours who has a special focus on an aspect of mental health that we don't often think about. So I'm going to take this opportunity now to ask Dr. Phillips to introduce our guest for tonight.
Well, I would like to take the time to introduce my dear friend, Mr. Darrell Green, soon to be Dr. Darrell Green, as he finishes his PhD at the Morgan State University in Baltimore, Maryland.
Yes, sir.
I've known Darrell for over 30 years. He's been an intricate part of my family, but he's always been a leader of our group of brothers, and he's always been one who's always been level-headed, and we appreciate that because it's helped us in some moments when we may not have been our best. He is part of and the leader of Deep Forgiveness, which is a non-for-profit entity in Baltimore, Maryland, which deals with mental health as it pertains to the issue of forgiveness. So, as Darrell and I talked many years ago, we always said as we elevate, we are going to give each other opportunities to share the great work that we have been doing. So I am extremely happy to have my dear friend and brother here to talk to us tonight, soon to be, and I'm looking forward to that day when I can say Dr. Darrell Green, but Mr. Darrell Green is right here with us. So what's the hit, brother?
Is it, man? Thank you, brothers. Thank you, Dr. Jedan. Thank you, all the brothers who's on the line, other doctors on the line, and all the other brothers around from the second D. I'm humbled and honored, man, just to come and sit before you, just to share a little bit about what I do. Again, I'm from Baltimore, Maryland, brothers. I'm a member now of Pi Omega, pledged spring 1987, 6D. It's an honor to be here tonight. Fellas, I want to just take a different spin brothers, I want to take a different spin tonight. I want to ask us all a question. Are you dying inside of unforgiveness? Are you dying inside of unforgiveness? And then we're going to talk about mental health and how that unforgiveness piece will show up. Again, I'm Darrell Green from Deep Forgiveness. This organization, my organization, is born out of a tragedy, brothers. There's a film, there was an 8-minute and 13-second clip, but for the sake of time, we'll even show it tonight. But if you're interested in seeing it, we'll talk about it later. You can go to the website. But my organization was born out of a tragedy that happened to my family, brothers. 6'5", 255. He won a shot put in distance his junior year, 3.5 GPA. Every college, university won him. Great young man. He wasn't bowling, y'all. And he checked his shoes, the shoes. A 14-year-old kid went behind the counter and took a shoe. An altercation broke out, guffed him up in the bowling alley. Man went threw the other kid out. He allowed my brother to go back to bowl. And as he went back to bowl, and as he went to leave the bowling alley, that 14-year-old kid, y'all, brothers, went home and armed himself. And as my brother went to leave, he stabbed him. Yeah, and he died 4 days later, shock trauma, Baltimore. I was a junior in college in North Carolina. I came home to kill him, his mother, his father, his sister, his brother, the dog, the ghost, the cat. I wanted to kill them all, brothers. I wanted them to feel the same pain, the same hurt that my family felt. And for a long time, I was angry. And I wanted to take revenge. In our community, in most community, what we talk is retaliation, looking through those lenses. Not really, we talk about forgiveness, but we don't really talk about it in detail when something major like that happens. And so this young man, he was 14 years old, young man going to an adult institution and going there and sentenced to life. In Maryland, life means your natural life. That means you're not getting out. He spent 25 in jail, and once he did that, I went to court. Let me just say, I asked the higher power, and whatever higher power you believe in, your God is awesome too. But I asked God to take the anger off of me and give me something else. I didn't know, brothers, what he was going to give me, but he gave me forgiveness. As a result of that, after this young man spending 25 years in jail, I went to court. The Edwards, I went to court, and I testified on his behalf for his release. I him. Therein lies the name of our company called Deep Forgiveness. Once that young kid, I went to court and we forgave him. And I asked the judge at the end, the judge modified his sentence, suspended life all but 30 years. And at the end of the proceedings, I asked the judge, I asked the bailiffs, actually, could I shake his hand? And I needed that, brothers, for me. All a part of my healing process. Excuse me, Dr. Plummer. All a part of my healing process. I needed that. And the bailiffs was like, oh no, that's not happening. Don't you watch True TV when they throwing the chairs over and jumping over and fighting? I said, man, you must not have heard me speak for the last 40 minutes. And the judge said, if neither man opposes, and he did not. And so I went beyond those little swinging doors in the court. And brothers, he had on a three-piece suit, not the three-piece suit that I know Brother Boykin wear, and others, but he had shackles here, y'all. He had shackles around his waist and shackles around his ankles. And as I went beyond those little swinging doors, was on both sides of me, and I stood in front of the young man who's responsible for taking my brother's life, and I said to him that he was known for, and I shook his hand. And when he shook my hand like this, brothers. And I knew that the hand he used to shake my hand with was the one he used to kill my brother. But I needed that again for me as a part of my healing journey. He was crying and I was crying. We're both emotional. And I said to him that you've been known for taking life. Now let's you and I go save some lives together. And about 3 weeks later, I get a phone call and he's on the steps of my work. And that's when our journey began in a different direction. Instead of revenge, retaliation, healing, reconciliation, forgiveness. And so I know some of you wonder, how can you forgive the person who killed your brother? I'll say to you, it wasn't me, man. It's the higher power who he gets all the honor and glory for it. Now, I won't tell you that some days I don't look over at him as he's in my driver's, as in my passenger seat, Brother Edwards, that I don't look at him like I can really, Dr. J, really do something to you. But the running piece is, if something happens to me, they're going to know the lie. They coming straight to you because you were the last person I was with. And so what we done, man, is just to come together, man, and try to help others to heal. We speak all over the country, internationally and globally on healing, reconciliation, and forgiveness. Sorry, brother. Sorry, brothers, I had to unplug the phone. So we speak country, internationally, and globally on healing, reconciliation, and forgiveness. We just came back from speaking at the first World Conference on Forgiveness in Tel Aviv, Israel, and also spending about 2 weeks up in the mountains in Ghana, West Africa as well. And so we're just trying to help folks to heal. My initial question to you is that how many of you are dying inside of unforgiveness? Right now, under the sound of my voice, I will submit to you that there is some pain in this room. There's some pain on this screen right now. Right now, we have brothers and sisters not speaking to each other. We have husbands speaking to each other, fathers and sons, mothers and daughters. I couldn't believe I spoke to one of our beloved fraternity brothers. He said he hadn't talked to his mom in about 7 years. And I said, have you lost your mind? Have you lost your mind? Do you realize how many people wish they can have one more conversation with their mother? Have her to tell you to take the trash out, eat a piece of bread or something. And you got a mother, you not speaking to her. If I could reach through the phone, brothers, I would probably lay hands on him or shake him up real good because he missed something about motherhood, right? He missed something. And so my question is, are you dying inside of unforgiveness? And if so, when are you going to take your power back? Because that situation owns you. At least for me, it owned me, right? And when we talk about mental health, we talk about anxiety, we talk about stress, we talk about depression. I had all of that, being angry. It took, well, let me just say, it took me 2 decades, y'all. Brothers, it took me 2 decades to get to where I am now. And again, sometimes, it's like the 12-step program in NAA. You might get to step 9 and something triggers you, something hits you, maybe a word or somebody, a gesture, and I may go back to step 3. But I'm here to tell you that forgiveness is not about the other person, and it's not for the other person. Forgiveness is for you. Forgiveness is for you. And as I said to you, I'm real clear that there's some brothers on this line right now that's suffering in silence. You're suffering in silence. You would just keep it 100. Some of us are a dressed up piece of mess. We present well, but really, we got some stuff that we're carrying with us, y'all. And so I'm just saying to let it go, let it go, let it go. Because, and stop drinking the poison and expecting somebody else to die. Because the only person who's dying is you. And you wonder why you're sick. You wonder why your hair falling out. You wonder all these other things that's happening to you. Yeah. It's that mental health aspect. It's that stress aspect. There's the anxiety piece, the depression piece. And so take your power back, brothers. Matter of fact, somebody who wronged you, before you get off the call tonight, Brother Boykin, text them and say, hey, I was just thinking about you. I want to tell you I love you today, right? I was just thinking about you. You know, I forgive you. Can we eat lunch or something together? But I just want to give you, allow us to look through a different set of lenses, y'all, instead of lenses of revenge and retaliation, eye for an eye, right? Look through a lens of healing, reconciliation, forgiveness. I'm gonna stop right there and let the brothers jump in and field any questions. I have more, but we'll to get the conversation started. Thank you, brothers, for listening. Brother Boykin, we can't hear you, sir.
Sorry. What a powerful presentation. I wish all of the brothers have the opportunity to see that video. I did see the 8-minute video. And what it speaks so highly of to me is a lot of things, the emotional trauma. We all as physicians deal with what? Physical trauma every day. You know, Dr. Wingfield probably deals with somebody that's had a heart attack or a stroke. He's an individual cardiologist. He has to go in and deal with that. And he does it because that's what he's trained to do.
Yes, sir.
But the mental aspect of that, I wonder what is going on in his mind when, like, we said, wow, you know, here is somebody I'm taking care of. Maybe somebody that got stabbed or something. Maybe somebody that got some type of injury, which is a crime against our own village. And then all the suppression that you have to do as a physician. You know, we suppress every day. When we see things, we suppress that emotion. It becomes a deep lying scar and part of our mental health. We're all trained to, like, be tough, you know, have a poker face when you're a physician. You know, one of the things I was always taught when I practiced internal medicine is that do not let your emotions when you lose a patient show forth. I was always taught that, you know, you just move on to the next. But this is deep emotional trauma. We have so many aspects we could talk about here. So I'm just going to pause there for a minute. And anybody that wants to chime in, talk about the emotional trauma of mental health that we presented here tonight about forgiveness, because it's a powerful piece of healing in mental health. So Anybody want to take a shot at that?
Yeah, I'll say something. I'm just going to credit Daryl, because Daryl was part of our crew in Maryland and Baltimore during our formative Omega years from the late 80s moving forward. And in that, we see each of us deal with things in a good way. We see each of us deal with things in a bad way. But the other thing we see life happen to each of us.
Yes, sir.
And I remember when life happened to me, and I had my oldest son, Jedan, passed from cancer, and I was extremely angry. I was extremely pissed off. And Daryl was one of the individuals whose transparency of his grace in dealing with his own issue helped me be stronger in dealing with my issue. And I remember friends of mine who approached me after my son's funeral and said things like, your emotional balance and grace has changed my life. And I'm sitting there, saying I was just following the lead of my brother, But again, as that started to take place and we move forward from that moment, the other thing that became very apparent in our collection of friends was a transparency about our emotional vulnerability. It became pretty routine. I love you, dog.
Yes, sir.
The conversations of I'm upset started to happen a little easier. It wasn't as it might have been at a time where we laughed and joked the person if they were exposing some of these feelings. But when we realized, and I know I'm in medicine, but I strongly attribute a lot of my maturity in that space from Daryl, because I saw Daryl be wild. I saw Daryl be good at being wild. And he could have stayed being wild and been great at that. But he took that power and helped all of us grow as emotional Black men, which was extremely helpful for what life may have had for any of us. So again, that's my 2 cents. I just wanted to say that.
I think many of us, we deal with all the time. We deal with things that, sometimes it's not so much us that we have to deal with. Sometimes it's like your patient will come to you and say, I hate so-and-so. I hate, like you said, Brother Green, I haven't spoken to my mother in years. Not me. My mother just recently passed. But, patients will come to you and say, I don't deal with my sister. I don't deal with my brother. We don't talk. We don't do anything like that. But just imagine all the pent-up trauma and anxiety from that.
Sure.
I'm sure all of us that are in primary care, we see that all the time. I mean, Dr. Isabell probably sees it in his practice of when he deals with his HIV patients. Dr. Plummer, and I'm sure he sees a lot of that in his women's health. And Dr. Ford, you got to see it every day. Every single day, you see some aspect of things. So if one of y'all would just take this aspect and that's really impacted you, somebody came to you and said, I'm dealing with something, I don't know where to go with it, what to do with it, and you knew they needed to forgive somebody or be forgiven by somebody. Anybody want to take that topic and kind of run with it for me?
Well, first let's start with what we're discussing with Daryl Green, Dr. Phillips. We're talking about post-traumatic stress disorder. That's the medical term used. All of us in our life probably has had one time a loss of a loved one or something tragic that has happened in our life, and we don't realize this is maybe symptoms of post-traumatic stress disorder. We may first feel a little anxious. We may feel depressed. We may feel like it's our fault. We may feel irritable, or if I did something different, this wouldn't have happened. We go through these different phrases, and then we don't know it. And we can go, sometimes we recover, it's mild, some go into a deeper depression or deeper anxiety, and not knowing that they have this or to help. Regarding me, when I go to primary care, I do primary care, and as well as HIV care. So I'll just example a newly diagnosed patient with HIV. At first, sometimes they may go into denial, they may be angry, or they may feel like their life is over, but not knowing what to do. But we try to calm them down, explain it. You have to show empathy. A lot of times, patients, they want you to listen first. Listen to their problems. When you listen to their problems, then you can give advice. Some don't like it where you give advice, you say this and this, but you're not really listening to what they are saying. Other experience, me being a primary care, and I said, don't you have a psychotherapist? I said, yes, Dr. Isabell, but you listen to me. You don't prejudge me. And they find that appointment. So that's just some of the things. And then the last traumatic, things we see due to COVID. And then just to bring recently, I wrestled in college, and one of my wrestling buddies, he committed suicide. Everyone loved him. I want to say his name, but that was a shock, a surprise. He had a nice smile. A lot of times you don't even know what somebody's going under. So that, I think of that every day back in college. Thank you.
Dr. Wingfield?
Yeah, wow, Brother Isabell, appreciate those words. And Brother Green, very powerful message that you presented. Really put you at a point where you just take a step back and just kind of take a deep breath and just try to take it all in. So I commend you for your for where you are in your journey getting there. Personally, as an interventional cardiologist, I feel that I can fix people. I can save lives, and I can go in and open an artery and get somebody back to health. But as medical practitioners, I mean, we deal with the good and also the bad. And I know dealing with, losing a patient can be, it can linger for weeks and into months. When you lose a patient, when you have to walk into a room full of family of that patient who passed away and tell the mom or the wife or the daughter or the son that dad's not coming home, he passed away. It's extremely emotional. Just watching how families react, watching how people fall onto the floor, everyone reacts in their own way. And you have to console, you have to advise, you have to answer questions. And then you have to, it hurts you as much as the family in some aspects. And it definitely lingers, and it takes some time to get beyond that. And as medical professionals, because a lot of times we do take what we do for granted, that we are in the saving lives business. And when patients have events that come out of nowhere, someone's working out at the gym and they drop and have a heart attack, and we get them back up to health. There is post-traumatic stress associated with those events. So these events that occur abruptly, and as medical practitioners, we kind of say, okay, you're going to take your medicine, you're going to do this, you're going to do that, and you're going to get back to your previous level of function. There is a healing process. There is a acceptance process. There's a life-changing process that occurs. You can have someone who was on no medications at all, and they leave the hospital on 5 different medications. They never had to worry about their diet. There are a tremendous number of changes that go into play. And if we don't recognize that as medical professionals, we're missing a big aspect of care. Because what we know is patients who have heart attacks or open heart surgery, 25% of those patients are going to end up with depression, okay, after that event. Stroke patients, a third of stroke patients are clinically depressed after they have a stroke. So as medical professionals, we get so accustomed to, just checking boxes. I did this, go home, and you take your medication, you do this. There is an aspect of care that even a story like yours really makes you step back and say, look, let's look at the whole person. Let's look at what they've dealt with and how we can help them go forward from this life-changing event. So I commend you. I applaud you. Thank you.
So how do you deal with Brother Green? The family member that comes in, as Dr. Wingfield talked about. All of a sudden, dad's not going home or mom's not going home, and then the family has the burden of, well, what if? What if I had intervened earlier? What if I had not ignored this? What if is a big question that comes up all the time. They are probably in the same position. When are they going to forgive themselves for knowing that they can't always prevent everything that's from happening? Because a lot of our people in our community say, well, if I had just done this sooner, what if I had done this differently? Even as physicians, sometimes you say, if you lose a patient that pretty much sure they were probably going to pass, but you always say, what if I had done something different? How do you address the what if question, Brother Green?
Brother Boykin, thank you, man. And Brother Wingfield, thank you very much. Listen, the piece that I'm from two angles. One, from what Dr. Wingfield was just saying about losing a patient, right? And them being messed up for a month, 2 months, right? Carrying that piece with them, right? And sometimes, and one of the toughest things to do, even for Dr. Wingfield and also that family, if they have that what if, is that self-forgiveness. Self-forgiveness is one of the hardest things, one of the most difficult things. The person that we violated, forgiven us, we've been forgiven, we're good. Nope, but we don't forgive ourselves. We don't take our foot off our own neck when we think we could have did something a little bit more in that medical procedure, or we think we could did something a little bit more as a family member or a loved one for that person. And so as Dr. Wingfield was talking about folks being clinically depressed, right? After having a stroke or having to have a heart attack, right? And that unforgiveness of self is a heavy rock, a boulder to pick up, to push up that hill. And so we address those issues, right? We address whatever issues, whatever concerns that you have, and try to help walk them towards the light, right? Because a lot of them are stuck, right? A lot of them are stuck right there in that space. And sometimes being stuck, they're comfortable there, right? But what we try to do is to help move them towards healing, reconciliation, and forgiveness. I always like to say, like your light and my light, Brother Boykin, is not at the end of the tunnel is not going to be the same. But there is a light at the end of the tunnel, right? 2 stroke patients, they have stroke. Both of them light they're going to be a light at the end of the tunnel, but it ain't the same, right? And so that self-forgiveness piece is crucial when dealing with both the folks on the medical side, right? If you carry that stuff home with you, and we do, because we're human. We're human. If you tell me that this don't affect you, you lying. You lying. I would come home from doing this in social work, and my family asked me how was my day, and I would just vomit all over them, right? And then they'll say, okay, in 10 words or less, how was your day? Or matter of fact, stay out in the car until you get yourself right, and then come in and deal with us, right? And so this work is not like a tractor trailer driver. You driving on Friday, you go parking in that space, and you take the keys out, you gone. No, the incredible work that you guys are doing on this screen, and other brothers that are doing on the screen is powerful, and you will be affected by it, as Dr. Wingfield said. And so take your foot off your own neck and give yourself some grace.
So I think part of the problem in the Black community or African American community, we always deal with the stigma. You know, we don't want to recognize that we have an issue going on. We don't want to recognize that we suppressing anger. We don't want to recognize that we have post-traumatic stress disorder. So, you know, a lot of patients will come to us. So what are some of the things that some of the docs on here are doing when people come to you? You know full well that they need to be referred for further help, but you know they're not going to go for it because you know they think it's a stigma associated with it. Anybody here have that situation?
Brother Boykin, let me just add before the other doctors, right? What I say to my students at Morgan, the illustrious national treasure, Morgan State University, and to make it normal, right? To make it normal for them. You know what I tell them? I said, my therapist got a therapist. They're like, Mr. Professor Green, what are you talking about? And I said, yeah, man, my therapist got a therapist. Because after they get finished dealing with me, they got to go talk to somebody, right? And we normalize that, right? And now our babies at Morgan State, I mean, they're young, I call them babies, but now the students at Morgan are saying, wow, my professor he's got a therapist. Well, I'll raise my hand. Look, I've got Professor Green to 30 other students in class. I have, I go see my therapist on Tuesdays and Thursdays. And then everybody else begins to do, and that's how we normalize it. Come on, Dr. J, I'm sorry.
No, I was just going to say, you know, again, that, you know, when you get the transparency from people in the community, sort of like the whole issue with the vaccination, they wanted to see someone they trust get it, and then they were a little more accepting of it. I think in seeing people, and as I brought the example up earlier, Daryl, you were one of the people that I saw that was comfortable in saying, I'm upset today. You know, and I think, you know, when you get that type of model, I think that is extremely helpful in normalizing and making it okay, because everybody thinks it's a major situation, but it's a pretty common situation. I think another thing that I wanted to touch on real quick was the whole idea of structural racism and institutional bias, because I think that plays a major role, you know, in a Black man's day-to-day mental wellness. And when you're able to acknowledge that type of circumstance as a provider, I think that makes the patient a little more accepting of the recommendations that you have, because I know for me, people that are trying to talk to me about emotions but don't understand the walk of a Black man in America, it's hard for me to really feel they understand where I'm coming from.
Absolutely. Go ahead, Dr. Ford, go ahead.
Yes. So one of the things too, a lot of patients want to talk. If you trying to get them to talk to a therapist, they want to see somebody that look like them. Right. And so, you know, that's a big thing to try to make sure that you have connections with therapists around, whether they're women want to talk to women, men want to talk to men, but also people of color. And so and we have a shortage, right? And we have a shortage of that. So that's what helps, I think, a lot of my patients saying, hey, I got somebody that looks like you, I got a young brother that can probably relate to you. Really? Yeah. And so then the comfort zone comes down. Yeah, I've sent many of patients over there, and I think a lot of people like them. And so that's how I kind of get around that to assure them that, hey, I'm going to send you to somebody that I think I would go to. You know,
exactly.
I probably should go to him from what you're saying.
Well, yeah. Well, people want to know, who do you know, patients ask us all the time, well, what would you do if it were your child? What would you do if it was your mom and your dad or whatever? And I think that you bring up a good point, Dr. Ford. We need to make sure that we are referring these people and helping them to understand that there's people out there that look like us. Might not be a lot of them right now, but there's people out there that look like us that are just as smart or smarter than the people that they think that don't look like us. I think we got to get that other stigma out of our society about, you know, there are no Black mental health professionals out there, because there are. So
the other thing was helpful now is that we have telemedicine.
Yes.
Right. And so, you know, it's easier to refer somebody that's a little bit farther away, that they may not have to get in the car, especially when you're dealing with mental health. You may not have to always go in to the office. I think telemedicine kind of helps that.
I mean, in my profession, mental health is really important because a lot of women are the caretakers. They're going under a lot of stress financially, emotionally. Some of them are dealing with sexual abuse. Also dealing with high-risk pregnancies. Some women, when they lose a pregnancy, doesn't matter if it's very early or close to term or at term, they go through a lot of guilt, even though it's not their fault. But also learning to let go a little bit of that guilt also, affects them. So there's a lot of, depression. Also, there is a paucity of mental providers to refer people to. A lot of people have a lot of anxiety. They have depression. They also have bipolar disorder. And one of the things that, is important is that they can still go to their therapist and they still can take their medications. Most of the medications that are taken to help control anxiety and depression, especially the ones that are used now, can be used in pregnancy. So one of the things is that, once they find out they're pregnant, they stop all their medications and then they have a severe relapse. And a severe relapse in pregnancy is probably worse than taking the medication itself.
Wow. Wow. So you talked about another aspect of PTSD, and that was the loss of a baby. And I think in my experience as a pediatrician, I think the most impactful time is when you have that mother that takes that child for 9 months and then they lose it immediately after birth, or they lose it within the first 6 months of life. That is the most traumatic thing that I've had to deal with as a pediatrician, helping them get through it. What if comes out again? That was the biggest thing I've always dealt with. What if? What could I have done differently? And as you said, Dr. Plummer, a lot of times there's nothing they could have done. It's just the way things are, particularly as you know, in genetic defects. We can't fix those things. Those are defects that come to us. But how do you get them to understand that, you didn't do anything wrong? Prepare them for having the next pregnancy. Because I think a lot of people, maybe you know better than I do, but a lot of women say, well, I'm not going to go through this again, ever. I'm not going to have another child. And they're depriving themselves of an opportunity to forgive themselves for the first pregnancy, if you will, use Brother Green's term, forgive themselves for that. So go ahead.
And also they have so much anxiety during the second pregnancy, which, sometimes you really have to talk to them and have to understand that as a provider, that they're going to have a high anxiety because of their previous pregnancy situation. And also, we also go through trauma too. I mean, when they lose a pregnancy, you do internalize it. And sometimes it's very difficult to sometimes talk to people about it. One, so we're always trained to hold in our emotions. Two, we also get concerned of medical legal things. We don't like to discuss a case just in case, there's some kind of retaliation. But, we go through a lot of, trauma too. And sometimes, to have a colleague that you can discuss things with, or even just sit around and discuss with the other physicians that are brothers, it's like a release valve that, you can, you feel comfortable in that space. So I'm kind of glad that, this conversation came about.
Yeah, I think, I want to give an example of a case that I had shortly before I retired. It's a young boy that was dealing with a lot of things. This thing called, I'm sure Dr. Wingfield and Dr. Ford probably heard, this POT syndrome type thing. He's dealing with that. But I sense an underlying sense of depression and anxiety. I sense a lot of withdrawal from this patient. And so I tried to gently, nudge the mother about it. I thought, there were issues going on, but nothing that was jeopardizing his safety. So, but to make a long story short, I was at home one evening. I got a call from our chief of psychiatry to let me know that this young man had taken his life. The first thing I did was like, what if I had just been a little bit more persistent about it? What if? But it was nothing that I could have done differently. But the healing process for me was to write a card, a sympathy card to that family, and praise the good aspects of that young man's life. Let them know that I was just not a person there, a face. I also had some impact from that young man taking his life. So we sometimes need to do that as physicians. I think it's a part of the process that we don't do enough of, that we're not taught a lot about in medical school. Like, there is a process when you lose a patient that's not through no fault of your own that you need to deal with, such as maybe calling the family or send them a letter. It doesn't have to be anything extravagant. But that's how you heal from your process of losing that particular patient. And it's not so much as forgiving yourself, but making yourself realize that you are not perfect, you know, there's somebody above you that does all more than you. It helping you heal. So
yes, sir. And Brother Boykin, I'm glad. I'm glad, as Brother Christopher said, that Dr. Chris said that we are having this conversation because, you know, it reminds us, man, the importance, brothers, of us checking each other's pulse, right? Just checking each other's pulse, picking the phone up and calling the brother and say, yo, D, I'm just calling. Dr. Jedan, Dr. Phillips does it all the time. He'll call and say, hey, man, I'm just thinking about you. I just stopped by. You all right? And it'll take all but 3 minutes, right? Mm-hmm. Even if we right now, and all the brothers that's under the sound of our voices right now, if they would just a week or a month, call 3 brothers that you haven't talked to in a while and check their pulse, right? I have a circle of friends that brothers in the 300 that we check each other. We check on each other. We do Zoom calls just to check in. What's happening? How you doing? How you feeling? Right? And being able to tell each other that we love each other, right? Because again, even right now, brothers, if nobody told y'all they love you today, let me be the first to tell you I love y'all today, right? That, you know, that and it's such a powerful piece, right? The same with forgiveness. It's so freeing. If I can forgive the kid who took my brother's life, words have power, and so if I can forgive the young man who took my brother's life, surely you can forgive your neighbor who parked half in your driveway, or your sister who regifted something, or your Brother Wingfield who acted a fool at your wedding, or whatever. You know, small stuff, right? And we say all the time, don't sweat the small stuff. But what do? We sweat the small stuff all the time, truth be told, right? And so, man, check on brothers, man. Check on brothers and truly ask them how they doing. How you really doing? Because we say how you doing all the time, but do we really mean it? Because that's just a word that come out of our mouths, man. Before we get off, I want to just run through a few strategies at the end on moving towards healing, reconciliation, forgiveness. Thank y'all for this opportunity.
So you brought up a point early on, and if you go and watch the video, hopefully we can get that link out to people to watch the video. But the other aspect of what you're talking about forgiveness is that now this young man has taken your brother's life, and he recognized that he's made a mistake later on, and then you help him heal from that. So you know that's part of the forgiveness process you talked about. Also, you help him move on from, like, I was a young stupid kid, you know, over something simple. I got to live with taking someone's life. You know, how do we get our young people to understand that, you know, they do stupid things like that, you know, unforgivable things like that. But there are people out there like us that they can talk to, they can come to. We can help them through that. You know, you want to talk about that a little bit?
We've all, every brother on this call and under the sound of our voice, Dr. Boykin, has done something at some stage in their life, and they got a second chance. They got a second opportunity, right? We're so hard, so whatever. This kid was 14 years old. Mm-hmm. And you know what he said to me? Dr. Isabell, what he said to me was, it was 3 seconds. He said 3 seconds. 3 seconds of rage, 3 seconds of anger. He made a decision that he couldn't take back. And how many of us don't get upset for 3 seconds, right? Somebody cut you off on you know, up in New York, you're moving and they cut you off. You got some choice words to say to them, right? And we get up. This kid was 14 years old. His mind wasn't even fully developed. He made a decision that he couldn't take back, and his mama couldn't help him. Anybody couldn't help him. So, is to talk about conflict resolution, motivation, self-esteem, dealing with anger. What do you do when you get angry? Is anger a good thing or a bad thing? And watching out for the decisions, because we talk to young brothers and sisters all across the country, and how to dealing with anger, and some of the decisions that they make, right? And then from the young brother's life, when he speaks, it blows him away, because what he says to me, I served 25 years in jail. I've already done it for you. I've done it for you. And so what we attempt to do is to breathe life into individuals, or try to be the conduit to help move you from being in bondage to being free, right? Because you can forgive just because you can. Every man, every brother on this call, you can forgive just because you can. It's a choice. Just make the choice. And when you do that, you'll be free. At least I was. And until you take your power back, that situation or that person owns you.
Exactly.
They own you.
Exactly.
Own you.
So you said a lot. You know, it takes a village. It takes a village for everybody to get through this. It takes a village to understand that mental health is just another aspect of health. There's there's no such thing as crazy and mental health. There's two separate words that don't even coexist, in my opinion. No one's crazy. You know, mental health means you have anxiety, you have depression, you know, you have some type of problem that you got to deal with that's not necessarily physical that you see all the time. So I think a strong point you made tonight is, you know, if somebody has wronged you, you can make it right by forgiving somebody. You know, and that's a part of it. That's a part of the emotional trauma that you take off yourself. Now you got to deal with the other aspects of it, is true, but you take that part off yourself by forgiving that person, so you can move on to your next phase of life. So we're kind of getting down to the end here, but I want to give you about 5 minutes. About 3 minutes or so to talk about some strategies. Then we'll have each brother give their closing remarks. So go ahead, Brother Green.
Well, thank you, Brother Boykin. And when moving towards healing, reconciliation, forgiveness, sometimes you got to take baby steps, right? Sometimes you got to make a plan, right? And you got to understand that healing and forgiveness is a process. It doesn't happen overnight, right? Some of us right now probably got a divorce from their wives, right? And y'all are just bitter. And the kids are all in the middle of it, the whole thing. It's not about them anymore. It's about those babies, right? You holding on to something. They already gone and got another husband. You got another wife, and they still bitter. I would say to you, don't be bitter. Be better. Don't be bitter. Be right, because I'm telling you, that situation owns you. Sometimes, man, we gotta see. Folks will say, "Go." You just gotta pray about it. Nah, sometimes you gotta go and seek some professional help.
Yes,
that's absolutely. That whole mental health piece, right? And mental health, sometimes it might be just a chemical balance. You might have to take something that balances it all out, right? Or you might just have to sit somewhere where you able just to talk to somebody. They're non-judgmental. They're listening to you. They give you some strategy, that sort of stuff, man. Practice unconditional love for yourself, right? I love me. Every day, every inch, every part, everywhere. I love me, right? And so because I do that, I try to stay away from the other stuff, right? Because that's going to take me down a dark road. Now, I mean, they call me the forgiveness guy, but I will tell you, if you smack me right now, I'm going to smack you back and take your head off your shoulders. And then we can talk about how we can heal, how we can forgive, and how we can reconcile. But, you know, brothers, it's such a powerful thing to forgive, because you're free now. You're free. And so I sure hope that I said something tonight, man, on the call, brothers. Thank you. I sure hope I said something tonight that made sense, right? Pick the phone up, man. Call your brother that you haven't talked to in a while. Text them. And watch this. They don't have to receive it. It's off of you now. It's on them. It's off of you now. I know it's difficult, Brother Edwards, Dr. I know, I see it all in your face. I know it. I know it, Dr. Winfield. I know it's difficult, but just do it. And if you want to blow somebody's mind tonight, text them and say, I was just thinking about you and tell you I love you and I forgive you. They ain't even got to respond, but it's all for you. Now you can roll now because you took your power back.
Thank you so much, Brother Green. Thank you so much. It's been a very, very interesting discussion tonight with a different aspect. We looked at mental health in a different aspect, from the aspect of forgiveness, which is a very, very important part of healing from some of the emotional trauma that we walk around with every day. So I'm gonna take this opportunity now for each of my brothers, my distinguished brothers here on this call, to give their closing remarks, and then we'll move on to a closing remark by Dr. Phillips. Go ahead, Dr. Ford.
Well, thank you, Brother Green. I think that was a very excellent presentation on forgiveness.
Yes,
we all need to reflect on that.
Yes, sir.
A lot of good things came up about checking on friends. We all need to check on each other. You know, brother on my mind. I think that's part of the mantle of Omega when we, I think Brother Marion talked about that. And, you know, as brothers and as physicians, we need somebody that we can talk to about even the stresses that go on even in our practices, you know, a trusted colleague or even a therapist. But I'm glad we brought the topic up, and I will take heed to that. Thank you.
Dr. Plummer.
Yeah, great discussion today. Actually, it released a lot of taboos. It opened up my mind a lot more than anything else about, you know, just, you know, releasing some of the discomfort and releasing some of the blame and pain that, you know, you sometimes carry within. You know, I had a very difficult weekend, and, you know, sometimes I think I blame myself. I said, maybe if I did something, you know, the outcome might have been different. But now just talking, just, you know, just learning just to let go and, you know, forgive yourself and, you know, forgive others will, you know, actually probably even brighten up my, you know, my day and evening today. So thank you.
Thank you, Dr. Plummer. Dr. Isabell.
Thank you, Brother Green and everyone else. Mental health, broad spectrum, is undertreated. It's very undertreated. We can go hours discussing so many mental illness. I bring to listen. I think listening is very important, even for the providers, or even for a family or a friend, or just listen to what they're saying. So when we go to the office, just briefly, when your doctor may or the nurse may ask you a question of, like we call PHQ 2 or 9, a patient health questionnaire. Some patients may not answer it honestly, but you may only be doing yourself disservice. They ask you, are you feeling depressed, or are you feeling lost, for example, doing activity? And there's a list of other questions that they may ask. Somewhat times I get around that. They may say everything's okay, but then, you know, you speak, you start talking to you. If you have a good relationship with the patient, you're hoping that they will open up. And the way you ask them, you know that it wasn't really an honest question, that they're okay. And sometimes we rely on families or others, friends too. Yes, there's HIPAA laws, but listening and to looking for certain signs of if they're changing, if they're not loss of sleep, they're just not doing what they want to do before. Then we talk about anxiety. They're always worrying. There's also we call GAD, general. It's assessment of anxiety. Also, that's other tools that we use in the office. So, what I'm saying, lastly, in closing, listening is important. Just listen to what they have to say. Don't think that the person is complaining, oh, I don't want to hear this anymore, because that keeping it in sometimes, and they can explode, and then that could be the last time you see them. But sometimes, you know, if a kiddo and it explodes, it's best to talk. Thank you.
Dr. Wingfield, quick closeout.
All right, I'll be quick. Okay, thank you, Brother Darrell, I really appreciate your input tonight and all that you really opened us all up. So the input from all of us was outstanding. I really didn't know what I was walking into. We talked about mental health, and we're going to talk about mental health. This was excellent, allowing me to reflect on things, and all of us too. So thank you. I'm gonna leave it at that. This was outstanding. We got to do it again.
So Dr. Phillips, you give us your month, and then I'll take us out.
All right. Well, again, Darrell, thank you so much, man. As a personal friend and family member of yours, just to see your path has been personally very, pleasurable for me, just to see where you're at. In addition to that, I think what Dr. Wingfield just said, I'm going to use a Jay-Z freestyle line, is pressure bust pipes. And unfortunately, too many times, and we have TikTok and other online vehicles that show people that are having the worst possible day and handling in the worst possible way. So again, it's important for us to take a preventive approach. That's been the theme of our monthly talks throughout the years, looking at different aspects. And again, if your mental health is not solid, it's like building a house on an unsound foundation. So as a family doc, like Dr. Ford and Dr. Isabell, we're primary care providers, that sometimes is the best place to start the conversation as far as figuring out what can I do and where can I do it. The last thing I would say, and this is the advice that a basketball coach gave me when I was playing in college, and this is the advice that I give to my son who's a basketball player, and then I recognize it's the advice that I can give to anybody, is have amnesia with your mistakes. My son missed a shot, bro, you got to keep it moving after that. You're going to have bad days as a parent. You're going to have bad days as a spouse. You're going to have bad days as an individual. But that one moment, do not allow that to define you. And if you don't move on from it, then you're going to allow it to, define you. And as I said at the beginning of my comments earlier, and I'll repeat it again, please attend and participate in our monthly preventive talks, because unfortunately, one of the things that we have seen, even though, you see equal incidents, just using mental health as an example of mental health issues in all communities, as far as being able to access help and utilize help, we fall behind. And I say we as African Americans fall behind in a major way. So let's do our part. Let's be our brother's keeper. Let's look at how we can help the next person. Let's be forgiving. So with that, again, thank you. And I see we have a new emergence of a moderator, 78. I'm going to let you take us out. And thank you so much, my brother, for leading this fruitful conversation.
My pleasure. Dr. Plummer, I'm sorry. Did I give you your closing remarks? If not, well.
Yeah, I did get my calling. I did get my closing.
All right. Thank you so much, everyone. It's been a very, very powerful discussion tonight. And, I want to leave you with this thought. If you love no one else, love yourself, because you need to learn to forgive yourself so that you can move on with your life. This is also National Stroke Prevention Month. So we want you to come back next month, because we're going to be talking about stroke. And these are things you should be focusing on fast, how to recognize a spot of stroke. But these are very, very important things to understand. And thank you all for coming out tonight. It's been a very, very interesting discussion, a different aspect of mental health. And we thoroughly enjoyed you guys having you guys here tonight. So with that, I'll say good night, and we'll see you next month.